Good day, I'm Crishelle Delos Santos, a nursing student. I will be demonstrating on how to do the postpartum assessment using the bubble heat technique.
Assess for the breast first. Check one at a time. Check for the lumps, bumps, discharges, and breast condition. And note for any abnormalities and the temperature of the breast using the back of your hands. Check the nipple if it is inverted, everted, or flat. If it has any crack or bleeding, it is a clear indication that infant has stool launching. Maintain the patient on the flat position, expose the abdomen, place one hand at the fundus and the other one at the bottom of the uterus. The uterus should be going back to its pre-pregnant state or 1 to 2 centimeters every 24 to 48 hours. So palpate deeply the fundus so we can feel if it is firm or waggly. Massage it waggly so that it will start to contract to prevent bleeding too much. Ask the patient when is her last time to go to the bathroom and ask how much. She could take precaution in doing this in a cesarean patient. Ask the patient when is her last time she emptied her bladder, so the usually postpartum patient don't feel like they are going to empty their bladder. So fill their bladder and remind them that their intake the same with their output. Listen to the patient's bowel sound. There's no reason for the patient to not have bowel sound because pregnancy doesn't affect her bowel movement. As for her last bowel movement, so 3 to 5 days post-delivery for not having her bowel movement is not usual. Now for the lochia, we're gonna check the mom's pad. The mom's vaginal discharge or the type of bleeding she has should turn different colors as time goes. So these cream white colors indicate that it has been 10 to 21 days since the mom's had her birth. This area must kept clean and dry, so the dissolvable suture takes 2 weeks to dissolve, so no intercourse to 5 to 6 weeks until the tissue has been healed. To check the episiotomy, we will use the Richter scale. It is assess the inflammatory process in tissue healing in the perineal trauma. We will evaluate the redness, edema, ecchymosis, discharge, and the approximation of the wound edges. Next, we will check for the human sign. So to check or to assess, support the back of patient knee and remain flat on the bed and ask the patient or help the patient to dorsiflex. If the patient felt any pain, which means that she's positive for the human sign, or she has DBP. If there is no pain, both cups, which means she is negative for human sign. For the emotional assessment, we will just observe the mother, how she has been, she is. We can also ask her how she feeling or does she feel any problem.